Hello, everyone. My name is Ron Daniels, and today I will go over the importance of folate and folic acid to prevent neural tube defects during pregnancy. So, to get started, what are neural tube defects? And they're a type of birth defects that occur due to the neural tube not closing properly, and this causes malformation to the brain and spinal cord. This defect occurs in about 3,000 pregnancies each year in the United States. And the most common type is spina bifida, which is a spinal cord defect. And right here it shows the three different categories based on severity. So the oculata is the least severe. It's depicted by this hairy patch and no vertebrae. The meningocele shows the cavity, and that is a more severe version, but not too much. And then the myelomeningocele is the complete. It causes complete paralysis and developmental problems for the child. And the second most common is anencephaly, which is a brain not forming correctly, the brain and the skull. It can cause the brain to be out or some parts of the brain not forming. It causes death to the fetus. So the most common cause of neural tube defects is insufficient vitamin B9, and I'll get into that later. So some risk factors. It's stated on the CDC that Hispanic women actually have a higher chance than non-Hispanic women of developing neural tube defects in their children. So other risk factors include obesity and diabetes type 1 and type 2, previous baby with a neural tube defect, illicit drugs, so that's kind of a given, and anti-seizure medications such as carbamazepine is shown to have a higher chance of causing a neural tube defect, and given is not ingesting enough folic acid, and especially during the fourth week of gestation, which is the time the neural tube closes and the formation of the brain and spinal cord, which is extremely important if you don't have enough of that. So, folic acid, it's the type of man made vitamin B9. So, I'll go over that in a little bit, but basically, it helps the body create new cells. It is also extremely important in red blood cell formation. And according to the CDC, women should, even before they're pregnant, should ingest 400 micrograms of folic acid a day. And this number rises to 600 micrograms a day for pregnant women. And if a pregnancy has already undergone a neural tube defect, it rises to 4,000 to make sure that fetus is getting enough folic acid. And in 1989, foods began to be fortified with this vitamin, and we can see the drastic decrease in neural tube defect cases due to this, like almost 30% everywhere. So this is a case study, and it was conducted in India in the Chettinad Hospital and Research Institute over a period of 5 years between 2009 and 2013. So out of the 3,220 deliveries between this time, 9 were neural tube defects, and this number was compared with the basically before the fortification 1987 to 2014, and we could see a drastic decrease. Almost 10 out of 1,000 births were not neural tube defect, which is mostly due to technology. We had better screening tools. We knew what to look for, and we also knew folate was such a huge part in this. So, some folate sources. So this is folate is a natural version of vitamin B9 found in foods and such like that, and folic acid is the man-made synthetic version. And the only difference is the body's able to absorb this better. So, in the synthetic version, it's a 1.7 times multiplier, and we could see some common food sources. But basically, what you want to look for is whole grains, dark leafy greens. That's what you look for folate sources. And so, in conclusion, the most effective way is to basically just make sure you're getting enough of this, either in the synthetic form, or just make sure you're getting enough foods that have folate in them. And that is probably the best way to ensure that you have adequate intake of these. But that you should make sure. And here's my citations. Thank you all.